I was a college offensive lineman and decided late in my college career to change to a nursing major, and was not your typical nurse at that time. And through the years, I evolved to this side of healthcare because I saw lots of fragmentation, waste, and non-consumer focus. So those who would tell you drives me is seeing the healthcare system change. Blue Cross Blue Shield of Nebraska has been here for 76 years. We've always been a not-for-profit, so we have to make a little margin to stay in business, but we're not in the business of making money off of the customer. They're our owners. So I think that's what's built trust over the years. We treasure that a great deal and would go to the ends of earth not to violate that trust. Because we live here, because all of our employees live here. We focus on building the quality of life and the quality of health and the quality of the community. So all of those things benefit us. The Blue Cross system is very unique and, to me, an incredible asset to the consumer. So while we're intensely locally focused, we also have a national focus together. It's always been about consumer, but in the earliest days of healthcare, the consumer and the provider of healthcare were fairly well aligned. Healthcare was relatively simple. The charges were very, very simple. But as things became more complicated, healthcare has evolved in a way that it's very difficult for the consumer to navigate. And so that's our focus, to work for the consumer and work in ways with the provider over time to simplify the system so that it's less complicated. So the next step in a healthcare world that reduces confusion and adds more years to life, we find it's essential to build better primary care delivery. There's more things than just the physicians identifying the problem and prescribing the solution. There's the coordination of medications, helping someone deal with a chronic illness or a short-term illness for that matter. Now we can do even much more care than we are today in homes or in step-down ambulatory settings, in outpatient settings, and that's what excites me. So that quest needs primary care. So we're in a pathway, I believe, over the next decade to move America more that model. And I do believe it'll be unique in the world, a world where healthcare is less complicated, where people access it more seamlessly, understand it, and add more years to their lives that are quality years. That's what I'm excited about.